Sean, can you give me permission to share my screen, please?
Absolutely. Okay, let's see if that works. Awesome.
Okay, hello everyone. And I guess hello, Dr. Mayrand, who's
Yes,
not
sir.
with us today, but is
Before you
watching this
continue,
video.
Bear, we don't see your presentation view. We just see the
Oh,
thing you have to share after you press present, basically.
oh, sorry.
No worries. That's perfect.
Okay. Is it still recording?
Yeah.
Okay. Hello everyone. Hello, Dr. Mayrand. So I've been randomly selected on behalf of ISGL Group 1 to present our final presentation, a biopsychosocial approach to the challenges of geriatrics. All right, so to begin with the definition, geriatrics has been defined by Merriam-Webster Dictionary to be the branch of medicine that deals with problems and diseases of old age and the medical care and treatment of aging people. So, as with any complex medical phenomenon, geriatrics can be best understood using a biopsychosocial approach. And so, this is the approach that we've used to break down the various components of geriatrics. So, let's start with the biological aspect. It's well known that many diseases have increased prevalence in the older population, and some of the most common being hypertension, osteoarthritis, heart disease, osteoporosis, and COPD. As people age, their burden of disease increases, and it's currently estimated that over 1/3 of seniors are currently living with two or more chronic diseases. Psychologically, older age also increases the incidence of several psychiatric and mental health conditions, an example of which is depression. So depression affects 15 to 20% of older adults, and the rates of depression are higher in those people who have other chronic illnesses or exacerbating factors like social isolation, as well as those living in long-term care facilities. There are many contributing factors to depression, including chronic disease burden, social isolation, bereavement, and financial stress. It's important to note that unlike depression in younger people, depression in the elderly can often present differently, um, often including things like somatic complaints and cognitive changes, not just your typical symptoms of sadness and low mood. Another social challenge that geriatrics entails is loneliness and social isolation. As people age and as they, move into assisted living and lose their ability to drive and their independence in general, many elderly people report feelings of loneliness. And this is a problem because it also predisposes them to other illnesses, as well as increases the risk of suicidal ideation. So these challenges that we've mentioned on the previous slide, are they currently being met? And so when we look again at the biological, psychological, and social challenges, there have been some efforts that have been made to remedy these issues. Biologically, the mortality of these diseases in the elderly population has decreased in recent years. However, because the population is aging, the more and more of these problems are being seen, such as dementia, Parkinson's, and hypertension. Psychologically, there have been efforts made at the provincial level to implement programs that address some of these psychological concerns like depression. However, there's an issue of accessibility for these programs, which prevents many seniors who need these programs and who might benefit from these programs from actually participating in them. And socially, there are various screening tools and resources in the community to help combat feelings of social isolation and loneliness, um, such as community center programs, telehealth programs, and other such resources that seniors might be able to access. But again, we run into issues of accessibility here as well. In terms of solutions, our group looked at possible ways that these biological, psychological, and social issues might be mitigated. And so biologically, this could look like ensuring medication management and mitigating the negative effects of polypharmacy, increasing primary care provider availability for geriatric patients, and staying up to date with screening and regular medical checkups, as well as, of course, maintaining physical activity and social supports. Psychologically, in order to improve morbidity from mental health conditions like depression, this could also include having routine screening for all older adults at their regular healthcare checkups and enhanced access to mental health services, such as through more community-based programs. As well, healthcare professionals could receive better and more specialized training in order to provide these mental health services to the elderly population. Socially, kind of in line with current efforts being made at the community level to improve um, the loneliness and social isolation situation that many elderly face. Um, more efforts towards this could include continuing to fund these programs at local community centers as well as in assisted living centers, and as well including things like animal therapy and video conferencing, and also having exercise programs and other forms of therapy to help improve the problem of social isolation, as well as doing things like helping with transportation, as that tends to be a big barrier to access for the elderly with regards to getting these services. And so we looked at how current policies, both in Canada and abroad, might be playing into the challenges of geriatric health. And so we'll start with Canada and then move on to some other international comparators. So in Canada, we have the ODBP, which is a pharmacare program that assists seniors with the cost of certain medications. We have various strategies that are provided to seniors free of charge to help them living independently in their own home for as long as possible. And this includes things like having community PSW support, as well as mental health outreach programs that offer support for individuals over 65 who are experiencing mental health issues. Just to compare our situation in Canada with the situation in Switzerland and Australia, Switzerland provides a program in which in-home support services are also provided to help promote their independence. As well, similar to how we have community-based programs in Canada, Switzerland also has a similar sort of setup where they provide seniors with things like fitness classes and other activities to help maintain their physical health and provide them with recreational activities as they age. Moving on to Australia, Australia, similar to Canada, has a pharmaceutical benefit scheme which subsidizes the cost of medications in seniors to help offset some of this financial burden. And it also has various assistance programs that assist with in-home tasks as well as meal preparation and various other things according to individual needs. And so in conclusion, the importance of good geriatric healthcare will continue to increase as Canada's population ages, and it's important to consider biological, psychological, and social challenges, as this is a complicated problem, and all three of these determinants are necessary to help tackle this problem in a holistic manner. And that concludes our group's presentation. Thank you for listening.